head of our health desk, Fred Smith, is with us, and we'll also be speaking to a senior research fellow at the Noguchi Memorial Institute for Medical Research, our foremost testing facility, Dr. Kofi Boni. Good morning, gentlemen. Good afternoon, gentlemen, pardon me. Right, okay, so let's begin with you, Dr. Boni. This morning, Dr. Abuaji mentioned that we have some constraints in terms of logistics. Can you explain that a bit further for us from where you sit at Noguchi?
Yeah, so, I mean, if you recall, Daniel, for the past few months, or let's say few weeks, some other laboratories were rolled in to also help with the testing. But it got to a time where they realized that they can't keep up because what we call the reagents and also the consumables that we use for the testing ran short for them, basically. So those who came to support and all that. So they have to more or less roll up, and the areas that were assigned to them now have to come back to Noguchi again. So basically, we ran out of logistics for, those that were being provided by Ghana Health Service to these facilities that joined, ran out of them, so they have to roll up, and Noguchi have to then come back again. Noguchi also depends on Ghana Health Service, but because it's also a research institute, usually gets support from other departments within the institute with some of these consumables and reagents. So even if the stock from Ghana Health Service is not available readily, they can depend or get some from these other departments to continue with the testing. So when they get it from the Ghana Health Service, then they just put them back. So that is why the Noguchi is still going, but some of these other institutes or laboratories that joined have to roll up because they run short of logistics. Basically, they are consumables and reagents that they use for the testing.
So, Dr. Boni, does it mean that currently the Ghana Health Service is not able to provide these consumables and logistics for even Noguchi?
I thought the minister just made it clear. Even if you have money now, it takes some time for you to get the needed reagents and consumables that you need. It's worldwide, people are all scrambling for these same reagents and consumables. So it takes some time for them to come in. We've been assured that in the next week or so, some will come in. So basically, that is what it is. It's not that Ghana Health Service is not. I think they have made orders of procurement, but we are yet to receive them. And if we promise that maybe next week or from next week, some of them will come in. So we are waiting for them.
So what's our current capacity, Dr. Boni? Are we able to put a number on
it? For now, we cannot put. We are still receiving in the range of 2,500 to around 3,500 samples on a daily basis. It's like a processing chain. We running the samples or processing from the initial stages is easy to do. We can just work on them to a stage where we call the extraction and the PCR stage. That is where we'll get a backlog because we can work on all the samples. You come to our cold rooms, you will not see physical samples there, but you still have backlogs because some of the stages, we cannot push it forward anymore because we are either the machines that we have, there are 4 for Noguchi. We are running them 24/7. But we have a lot to put in there because other labs have brought theirs. So though we have cleared what we call the physical samples as backlog, we now have backlogs within stages of our processing unit. So we have backlog between extraction and PCR. And that's why we are trying to get them cleared, because of the numbers that we are getting in. But Ghana Health Service, well, they are doing their best by giving us what they have and also assuring us that what they have procured will be with us in due course.
So what's the size of the current backlog? Can you tell us that?
We have about 7,000 to around 8,000 samples in there that are yet to be cleared.
Over which period have these samples accumulated?
With the period, we work on daily basis. So every day we move some along, and new ones coming. So it's difficult to define or to make a definitive case for a period. So we can say that for the past week, it has not gone up and it has not reduced drastically. We maintain that number between 6,000, 7,000 samples in that range, in that stage of processing.
Okay. So if I'm to understand you, you are still completing tests, but there's always a lag of about some 7,000 to 8,000 samples that have not been completed yet.
That's correct. So we are completing tests every day, but there's always that lag of samples. Another thing too is that we are working on clinical samples, but we have priority samples that come in. So assuming we are doing our routine schedule of trying to clear the lag, if, for example, in a day we have about 200 samples as priority, either hospital emergencies or sometimes maybe from top hierarchy positions, maybe ministers, parliament and all that, and they really want the results as early as possible. Then we have to stop what we are doing, then attend to them. So some of these things also bring in the delays. So it's not only the normal routine work that we're doing. Sometimes we have these ones, I will not call them distractions, but more or less it also brings in some delays. We call them priority samples or emergency or urgent samples. We have to attend to them. And that will have to mean that you have to stop your routine testing and pay attention to them, and that will delay you. So basically, these are some of the other reasons that we have. So, then another thing that is also very important is that, for the month of June, we had a lot of positives. So we were doing what we call, before June, we were doing the pooling that I think we have spoken about it before.
Yeah.
Yeah, but for the month of June, because of the number of positives that we are having, we have to stop the pooling. For pooling, it is very prudent to do pooling where we have less positives. I mean, when the prevalence is low. But where we have a high number of positives, it will not be very prudent for you to be doing pooling. So for some time now, we have stopped doing pooling. So it also accounts for this lag, because assuming we're doing the pooling, it would have been going faster than what we've been doing now. Now we are doing individual samples, so it will take some time for us to clear that backlog that we have in that processing line, that PCR extraction stage.
It's interesting, Doc, because I had actually written down here that research had indicated that pool testing is for a positivity rate of below 5%, and we've crossed that. So I'd actually noted to ask if you were still doing pooled testing. It's good to know you're not anymore, and if I may ask, at what point specifically did we decide that we are not going to do pool testing? At what point in June?
We stopped doing pooling, I think, at the first week in June, when we realized that we were getting a lot of positives. If you do pooling, we have to do on pooling. So if we are on pooling so many, then you know that we are not good, we are not in for good business. That means we have to do a lot of more work and spend more reagents. So we stopped, I think, at the first week of June. So since then, we have been doing individual samples. We've not been doing the pooling again.
Dr. Bonnie, please hold on just a moment for me. We've been joined by Fred Smith, the head of our health desk, who is currently receiving treatment from COVID-19. Fred, good afternoon. I have to ask, how are you doing? How are you feeling?
Yeah, I'm good. I'm good, Daniel. I'm doing very well.
That's great. Now, actually, so this morning we were speaking on Prime Morning, and you made a point that really stuck with me about how, I want you to explain it for us again. How does the delay in test results coming to you affect you personally? I mean, you tested positive. How did that delay in receiving your results affect you?
Well, when I took the test, I was confident I was going to come out negative. But unfortunately, I received my results about 10 days later, and it showed I was positive. Throughout that period, I mean, I didn't take the test because I had come into contact with anybody that I suspected could have had transferred or, passed on the virus to me. I did it as a precaution because the multimedia group decided to test everybody to be sure who has contracted, who hasn't. And mine was positive. Two other persons that I was in a vehicle. In fact, two people joined me to the testing center. We were all in our masks, and all of them are also positive. I don't know at what point I became positive. And between the day of the test and when my results came, I was still working. I had interviewed a number of people, including the Foreign Affairs Minister, the Deputy Health Minister, Dr. Bernard Okuboy, and many others before the results came in on Monday, and it showed I was positive. I don't know who I have infected between the day I took the test and when my results came in. And that's what the delay is doing to us.
Fred, thanks so much for painting that picture in a very clear manner. I'd go back to Dr. Bonnie now and ask how long, because Dr. Abuaji explained that this delay is because of this situation you're explaining to us, that even though we have the money, we can't get the reagents to buy. And so there's a bit of a delay in there. At the moment, what would you say is the average amount of time it takes for you to get back a test result after you receive a sample? Is it 3 days? Is it 2 days? How long? Right, Dr. Bonnie.
For the question.
I was asking, pardon me, I was asking how long in your estimation?
I think I got a question.
Yeah. Can you?
Yeah, so basically, I mean, when we started, we were doing 2 to 3 days. And we are still doing that. But, when you take a sample, usually the samples that come to us, they come from the health directorate. It could be maybe Wejagbawe Health Directorate, it could be Lang Kwantanan and all that. And these are the people who take the samples, and the results are sent to them, sent to the directors. So if your sample is taken and you require to know your results, you see, you don't wait. Sometimes they have a lot of them, they have a lot on their hands. So you don't wait for them to maybe get back to you in a week or so. If after about 3 days you are not getting, if you make a call to them, oh, please, my sample was taken this time and all that, do I have any response or do I have any feedback? But people usually wait for them to be called, or they wait after a long time when they're not hearing anything, and then they come complaining that they've done this test and after a month or so they are not getting. I think that's not right. Results, samples that are sent to us by health directorates, results are sent to the health directors. So people should just go back to them and ask them for their results. You only come to Noguchi where we have issues. Maybe the health director is not getting the results and all that, then you come to us and we find out why the delay, then we try and sort people out. But for now, we are still doing 2 to 3 days. We are not doing anything more than that.
I find that interesting, Dr. Bonnie, because Fred is not the only person I know who has tested and has not received and did not receive their results within the 3 days. In fact, I know so many people who tested, and after 2 weeks, after 3 weeks, they keep calling us and asking what's the problem with their test results. So does it mean that from you, it gets to the health directorate and that's where the delay comes?
Yeah, so Daniel, I mean, all those people that you are talking about, I don't know how they inquire about their results. In the first place, where they do the testing, did they go to a testing center, or are their samples taken by other people who are maybe, let's say, they are working with some health directorates and all that? If they do that, then where do they go? There's incumbent on them to go back to those same people to collect their results, or to call them to get their results. That is what we say. If there are, I know where we have instances where we have had delays, which are genuine ones. Either samples were not taken properly, that we get back to them to get us new samples, or there were issues with the samples that were brought in when we're doing the processing. Then we always get back to them to get them. So those ones, they delay. Yes, we admit that. But for Noguchi, we try to meet the 2 to 3 days time that we have given to people. So we always try. Yes, we have backlogs, but we try to do that. If for some reason your samples are delayed and all that, and you get back to us, come to us, and we check, and it is a genuine case. Maybe either something happened, we didn't see your sample early, or it was not brought in. We do those investigations and we rectify it. But we try to do the 2 to 3 days that we've always told people about.
So Fred, let me quickly come to you, because I'd like our viewers to have an understanding of the management process. So who contacted you to let you know that you were positive? I know that you took the test as part of the mandatory test organized by this institution, Multimedia, but who contacted you and who managed that process, Fred?
Well, I had a call from a staff of the Ghana Health Service. So I presume they are part of the case management team. They called me and told me what my situation was and what I needed to do. And I followed that instruction, and this person made me aware that they were working closely with the management of the multimedia group since they organized the testing. And since then, I've also had calls from the HR and other officials at the multimedia group, helping me to, to get back.
Okay, so I think, Dr. Bonnie, it's in line with what you were telling us, that the general management, especially the interface between the person being tested, is the Ghana Health Service. So there are a few questions to answer on that regard. We want to thank you so much, Dr. Bonnie, for joining us. And
but Daniel,
Fred.
Yes. So this positive test is actually the second I have taken since the outbreak of COVID.
Okay.
I took a first test, which also took about a week to get a result. That particular test happened at the Achimota Hospital. So I was referred there by the Greater Accra region head of the case management team. And so this is a very highly placed person who could get things done easily. I was expecting my results in. I wasn't sick, I wasn't exposed in any way, but I needed to do that so I could return to work. It took 1 whole week. I called almost every day after the test. It still took 1 week, even with the protocol.
Yeah, and Dr. Bonnie was telling us about this phenomenon called priority sampling, which, it's quite unclear, but...
Daniel, yeah. Daniel, can I just say a word before maybe you... we have the strong evidence, scientific evidence that, if you are asymptomatic, there's no chance of you transmitting. So for your colleague, that is first situation where he walked in, or his sample was taken at the time that he was not showing any symptoms, and he tested positive. That is, he's asymptomatic. Yes, fine. But then he's not possibly going to transmit. You can have the virus being asymptomatic But that doesn't mean that you'll be able to share the virus or transmit the virus to others. It is only when you start showing any of the flu-like symptoms, coughing and all that, that you have to maybe stay at home, try to be away from others so that you don't pass on the virus to other people. So for this case, yes, he was asymptomatic, but it doesn't mean that going to work and all that you'll be sharing the virus.
I have read an article that suggests what you're saying, but I remember very well that the WHO scientist who gave the interview said that the sample space they used in that research was quite small, so she would be careful in giving that as an omnibus conclusion. Dr. Bonnie, is that the case? Yes,
but I mean, new evidence has come out that strongly supports that they've done so many. I mean, they've brought in so many people and tried to see if the asymptomatics can transmit, and they don't have that concrete evidence. Okay. They don't have that concrete. In fact, when it started, we all thought that was the case, but now they are disproving that particular that view that we had initially. So I'll be careful to say that yes, they are still doing more on that, but we shouldn't make it a rule that now I'm taking the test, I'm not showing symptoms, so then I have to, stay away and all that. Yes, it's good to stay away when you are sick, but for me, I'm thinking we should try and go with the new evidence that is coming up. Though it's not enough, and more are coming out. But I think that it is more credible than before or than what we were thinking at first.
Thank you so much, Dr. Kofi Bonnie,
Dr. Bonnie,
Senior Research
Dr. Bonnie, then in that case, I have a question to ask.
Right, Fred, keep that in 30 seconds for us, Fred.
I'm also eligible, and I'd like to take advantage of this and register myself. But because of my situation, I've decided not to step out. Is it the case that because I'm asymptomatic, I can go out and get myself registered?
Yes, but you are going out, you are going to be in the midst of others. So, the protocols still hold. You have to wear your mask and make sure that social distancing is observed. That's fine, because you go there, people who are there, some of them may be coughing and all that. So you wear your mask and ensure social distancing. Right. All the other protocols, you have to observe them. Right. That's fine. I don't think there's anything wrong with that.
Gentlemen, thank you so much for joining us. Fred Smith is the head of our health desk here at Joy, and Dr. Kofi Bonnie is a senior research fellow at Noguchi Memorial Institute for Medical Research. That's the foremost test center for COVID-19 in the country.